My name is Sosha Bielski, and I'm a national reporter with the Globe and Mail. The global pandemic exposed how thin women's gains were around unpaid care work. Throughout the crisis, Canadian mothers rapidly found themselves sidelined from their careers and relegated to traditional unpaid care roles. It's estimated that during the pandemic, women put in the equivalent of a second shift beyond their full-time hours, caring for young children, navigating the new world of homeschooling, devoting more hours to domestic labor in lockdowns, as well as to the care of their elders. Today, we'll be taking a close look at the inequalities exposed in the pandemic around women and unpaid care work, with a specific focus on childcare. When childcare collapsed in the pandemic, the consequences for all kinds of mothers were very steep. We know that twice as many women compared to men exited the labor force between the onset of the pandemic and this past September. That's 113,000 women compared to 53,000 men. And nearly 60% of Canadian women reported their mental health had markedly worsened since the onset of the pandemic. A third said they were extremely stressed most days. 20 months into the pandemic, mothers continue struggling with overload between their work lives and home lives. Today, we'll be looking at their realities and what it takes to remodel childcare in Canada to better serve working mothers through this recovery phase, but also into the future, including through future crises of this magnitude. And with that, I'd like to introduce our panelists. Susan Prentice's research focuses on gender, families, and social policy, with a specialty in historical and contemporary childcare policy. She holds the Duff Roblin Professor of Government at the University of Manitoba. Jane Bertrand is Program Director at the Margaret and Wallace McCain Family Foundation, which focuses on early childhood education practices, policies, and research. She is Adjunct Professor at OISE in the Flex Early Learning PhD program. Jane received an honorary doctorate from the University of New Brunswick in 2013. As Executive Director of Childcare Now, Canada's national childcare advocacy organization, Morna Ballantyne works with others for a publicly managed and publicly funded Canada-wide system of early learning and childcare. Morna is on Canada's Task Force on Women in the Economy and served on Canada's Childcare Expert Panel. Carrie McQuaig is Fellow Early Childhood Policy at the Atkinson Centre, Ontario Institute Studies in Education. She co-developed and produces the Early Childhood Education Report, which tracks provincial and territorial progress in early years policy. She has authored studies commissioned by the Senate of Canada, the governments of Manitoba, New Brunswick, the Northwest Territories, Nova Scotia, British Columbia, Ontario, and the City of Toronto, as well as for labor, women's, and community organizations. Thank you all for being with us today. So I wanted to start off by asking you, for the lucky Canadian mothers who managed to keep their jobs and work remotely from home in this crisis, the trade-off was often extreme burnout as their paid work collided with childcare, virtual schooling, domestic labor, and elder care in some cases. I wanted to ask you what your sense is of the long-term consequences for this group of mothers, both socially speaking and economically speaking.
Well, Zosa, I think we have to agree that mothers have always done a double shift. I mean, dads may be spending more time with their kids than before, but mothers still take on the bulk of the household duties. So that when the pandemic hit and childcare and schooling was added to the mix, we did see a lot of mothers leave the workforce. And then Canada-wide, just a little over 56% of women of working age have paid work. And we haven't seen levels this low since 2002. But meanwhile, Canada is short about 400,000 workers. And at the end of the day, it's not businesses that create jobs, it's consumers that do. And without more women working, there's less purchasing power to support economic recovery. We know that family poverty is growing because in homes without two working parents, they are third more likely to be poor. And not least, we've seen the setback in gender equity being reversed.
And Jane, you mentioned that women are sort of still weighing the pros and cons of sending their children to childcare right now. Women working remotely are still making that gamble. Why is that? What are they weighing?
Well, I think mothers and some fathers are remain concerned about the safety of settings for their children and are reluctant to send their young children back into settings that may not be high quality and might have been able to be okay with them before, but now with the pandemic and those additional concerns, they're holding back. And more mothers are jeopardizing their careers. They may be trying to hang on, but they're not able to work the same thing. And some fathers, but as Carrie pointed out, it's mostly mothers. And that continues and will continue until there's confidence in how schools are being operated and how childcare centers, that we can ensure the quality's there and that we have a qualified workforce there.
Sosha, if I could just add to what Jane said, I really agree with that analysis. And in fact, we were involved in a survey of childcare centers in July of 2020. And then the Childcare Resource and Research Unit did a follow-up survey in May 2021. And one of the things that we found is that there are still a lot of vacancies in regulated or licensed childcare. And a question was asked, so what do you attribute the vacancies to? And the main reasons were exactly what Jane said. Still a lot of concern on the part of parents around the safety of placing children. And, you know, the concerns go up and down, but they're very much linked to issues of quality. And the other big issue is that a lot of women are actually not back at work themselves and are also have really suffered financially, even those that have. And so it's extremely difficult for them to be able to go back and afford the very high childcare fees. So, you know, we're not out of this by any means. And I also just want to pick up the point that Carrie made at the beginning is that, of course, you know, the pandemic really reinforced a lot of what mothers, especially with younger children, have been dealing with, you know, throughout the time. It's so difficult to participate in the paid labor force when you're a mother with a young child, and even more difficult if you have more than one child. But what I think was different about the pandemic, and why we often say that it gave light to the issue, is that there were many mothers of children right up to, you know, ages even into high school that were struggling with both having to address and support their children, you know, of age groups, and at the same time deal with a lot of supports, including elder care. But the problems that mothers with young children were facing were actually very similar to what mothers with young children have been facing, because they're always scrambling. They have always scrambled because there have not been in place the proper supports for mothers and for fathers, but especially for mothers.
You know, speaking of supports, sorry, go ahead.
And you know, we need to acknowledge that it's not unreasonable for parents to be concerned about this, you know, the safety of schools and childcare. These are two heavy vectors right now for the spread of COVID. And even though young children may not get as seriously ill, there are real worries about, you know, first of all, bringing COVID into your home where there may be other compromised people, but also the dangers of long COVID that is popping up with children now as well. So this isn't about parents being unreasonably skittish. They've got real reasons to be concerned about the safety of their kids' environments.
And, you know, we spent much of the national discussion in the media focused on women who had the opportunity to work from home and the way their home and work lives were colliding at home. But we didn't speak enough, you know, in our role about women who didn't have the option of telework. So women who had to continue commuting, working non-traditional hours, weekends, evenings, women without paid family leave or affordable childcare to them. And that group can include paid child givers themselves, you know, women who of course are also mothers themselves. I wanted to ask you, what are sort of the persisting consequences for this group of women 20 months out?
Maybe I can jump in. It's a giant swirling mess out there. The economy is a complicated place depending on what your education background is, where you live, what kind of work you do, whether your work is precarious or stable. Women worked in sectors that were hardest hit. It seems pretty clear that there was what in my biz we call a socioeconomic gradient, which is to say more affluent women with more secure jobs had a higher chance of being able to work from home than women who worked precarious service sector. This means, of course, where racialized women are more likely to be found, and new Canadians and the rest. So what we do know, if you calculate it carefully, right, aside from money you lose today and the cost you have to bear today, there's lifetime consequences for time out of the labor force in terms of contributions to pensions and all the way through. So we're still in the midst of tracking all of this, but it's very clear that while most people were hard hit, some people were exceptionally harder hit, and women among them.
And Carrie, I wanted to ask you specifically about paid caregivers who happen to be mothers themselves. How are they sort of left behind in the crisis?
As you pointed out, the pandemic really exposed just how undervalued the early childhood workforce is. And in many cases where schools closed, childcare was often ordered to remain open. Yet staff were the last in line to get protective equipment. They were not included in the priority groups for vaccinations. Many did not receive pandemic pay. In Ontario, we had a case where construction workers could access free emergency childcare, where the women who were looking after the children could not. And as we were saying, meanwhile, they are highly exposed to COVID due to the kids that they're looking after. You don't keep toddlers 6 feet away from you, and it becomes really clear because the public empathize with the demoralized healthcare worker, where the demoralized childcare worker isn't even on the radar. But we now have more than 1 in 5 people who were working in childcare prior to the pandemic who have not returned to their jobs. And in light of, so this then has the ripple effect, because if childcare can't return to capacity, let alone expand, this will affect the ability of mothers to return to work as well.
So it's just a horrible cycle. And what the realities you speak to regarding like construction workers getting PPE first and emergency childcare, it speaks to the undervaluing of this sector that cares for our children. Jane, you mentioned another cohort that was sort of overlooked throughout this crisis, namely grandmothers who put their careers on hold or maybe reduced their work hours to provide emergency childcare for grandchildren. Can you tell us a little bit about what they were up against and how this sort of affects their economic and career prospects? I believe Statistics Canada found there are 42,000 fewer women age 55 and up in the workforce as of this past September.
That's right. I mean, you mentioned the number, twice as many women as men didn't return. A lot of them, over a third of them, were women 55 and older who did not return to work. And I haven't seen any specific evidence of why they didn't return to work, and clearly there'd be a number of reasons, but I strongly suspect one of them was caring for either elderly family members, but I think a lot of them were caring for their sons and daughters, young children. Certainly, Morna already alluded to the fact that she has been doing some of that. I have too, and I think Carrie has. But we're all pretty privileged in that we do have flexibility. We've been around a long time. We can probably accommodate it without maybe going a little nuts. But when I think about what other people are dealing with, it's pretty minor. But I think many women couldn't do it, so they left the workforce. And I know, even though there's no evidence, by walking around Toronto downtown parks at 10 o'clock in the morning in middle of September when school had started, and seeing so many grandmas women who children were calling grandma or nona or noni, or so these were grandmas with young children. I think that a significant number of these women have left the workforce completely, aren't earning a living because they're helping out and caring for their offspring's children. And this is going to have an impact on their future retire benefits, significant impact for many women in my generation and a bit younger, who were not necessarily in the workforce nonstop, may have taken time out. The years between 55 and 65 and 70 are absolutely critical to having decent retirement benefits. And I suspect a fair number won't be able to do that. And I think that's another factor that's brewing there.
And I think I suspect it's an ongoing problem because while schools may be open, every time someone has a cough or cold, they're sent home, and the work leniency has now gone out the window. So we lean intergenerationally, right? So this is not over.
No, every cough has to be met with, and I understand why. I want that to happen, but somebody has to stay home, and it can't, you've got to be careful how you stay home. You can't see other people till you've sorted out and gotten tested, etc. Absolutely, it's ongoing. And then there are many families who kids have entered school and get a full school day in Ontario from age 4 on. But there's a lot of reluctance for the before and after school because it might be a different group of children. So the kids are seeing, Carrie mentioned kids as vectors for the virus. So many families, okay, they can hold their breath and send their kids to one place and they've sussed it out and there's a ventilator, but they back off being able to do extended day with different groups of kids coming together, et cetera, et cetera. So again, I suspect many of the 42,000 women 55 and older are also are making that, filling that gap for before and after school.
This is one of the reasons, if I can, is, many Canadian families live in a childcare desert. There just aren't services where they live, and where services exist, they have to be paid for and the costs are high. Even before the pandemic, we did not have enough licensed childcare spaces for all children who might need to use them, and things have just gotten worse. So I think one of the things that's happened is how much social life, normal functioning relies on women being able to manage their family needs. And when it's all gotten so much harder, this invisible crisis that was simmering for decades has suddenly broken through, and it's now a big public issue.
We talked about how much the sector is undervalued. I wondered, what did the pandemic tell us about just, once it all collapsed, much like other sectors, in this crisis, what did that tell us about how undervalued this arena is, and where was that issue the most pronounced? Morna, could you speak to that?
Yeah, I think what we saw in the pandemic was a real breakdown of systems, and we saw very clearly the absence of systems. So for childcare, what we saw was an absence of a system. We have a school system, we have a public education system, we even have a health system. They were under incredible strain and still are because of the pandemic. But schools did not shut down. There was not risk of schools never reopening. In the childcare sector, there was a risk, and this has proven to be the case, of childcare centers or family childcare providers never reopening. Because what we have is where there is childcare, it's sort of there because individuals or organizations, private, whether they're profit or not for profit, have essentially set up shop. And they've received government support to the extent that they get some operational funding, but it comes in dribs and drabs and it's not sufficient. And they depend almost exclusively, at least outside of Quebec for most of its childcare, on parent fees. So what had happened during the pandemic is that when parents, as we've said, had to withdraw children from programs, or where centers had to close down for health and safety reasons, or because they couldn't find staff because the staff were sick, or looking after children because they couldn't find care for the children. What we saw was that collapse. And because they're so dependent on parent fees, if parents aren't bringing in the children, there's no revenue. And so what we saw, interestingly enough, is the survival of the sector became completely dependent on government. Largely the federal government, interestingly enough, through the federal COVID programs, like wage subsidy programs, like rent subsidy programs, that kept a lot of the doors open. But even then, we lost a lot of spaces. And of course, the problem we have now is, as we said, is that because we still have vacancies, that means that centers or family providers are not getting parent revenue. And so they're still at risk of closure. So what we really saw was, this is the problem when you leave an essential service, and everybody now agrees that childcare is an essential service and that those who provide childcare are essential to the provision of the service. They're essential workers. So even though it was essential, it's not funded by government and managed by government as if it was essential. So it's not like the public education system or the healthcare system where, hospitals, community health centers, schools receive funding from government, and their funding was not cut off as a result of COVID. In childcare, their funding was cut off because they didn't get the parent fee revenues. They're dependent on that. So that's really what we saw. And by the way, it's not the only system failure. We've just talked about the fact that grandparents might have had to step in. One of the reasons for that is that the younger generation, young workers, do not have good jobs. They don't, they work in precarious situations. They don't have access to benefits, employer paid benefits, and we don't have good public benefit systems. So, this is what we saw is really the failure of government and, the public to fund what is really necessary for people to just survive, to be able to get to work, to be able to make an income, to be able to maintain their health and safety. That's what we saw. And that's really what has to change, is we need a system of early learning and childcare. Early childhood education and care goes by different names, and it has to be fully publicly funded. You can't leave this vital service to the market any longer. And I think now that's been recognized.
Yeah, it's
I think the other player that we have to consider in all of this is kids, because when moms lose their jobs, kids lose their childcare. So that means they lose their educators, they lose their friends. And that doesn't happen with schools. Whether your mom works or not, you still get to go to grade 3. But if you're 3-year-old and your mom loses her job, you're kicked out of your care because she can't afford to pay for it anymore, or the subsidy that she was getting is no longer available to her. So this is just picking up on Morna's point, this is the difference between a public system and a market system.
And the damage done to children as a result of the collapse of the childcare system, we're going to have to research that and study that. And I'll just tell you personal experience. I have 3 grandchildren, all under the age of 5, twin grandchildren, both girls were born in June of 2020, so after COVID. I'm so grateful that they were twins, because if they weren't twins, one would not have seen another child for months. And they're going to be starting in a childcare program next month. And it's going to be really interesting because they have really not had the same opportunity as their older sister did, age 4, to be able to get into an infant program, to be able to, from a very early age, draw all the benefits of a quality program, early childcare program.
Mm-hmm. We also know that across the country, the rates at which the system collapsed varied. Like in Quebec, for example, where the system is stronger and there's a longer tradition of public funding, there's a much lower risk that childcare centers that have closed and where jobs have been lost, they're more secure. They're coming back in stronger ways. In other parts of the country, especially where the rate of commercial childcare is higher, centers have closed faster and the risk is higher. You can look cross nationally and see how different countries have managed it. These are clearly the result of policy choices that we make, and different policy choices can produce a more stable or a more unstable childcare system. And I think we're all watching now the price that Canadians of all ages pay when we have to live with unstable childcare arrangements.
Well, where we haven't seen vacancies, that's such a good point, Susan, and we have the evidence. Where we haven't seen vacancies through COVID or now, even in these later stages of COVID, is in Quebec in the not-for-profit center-based system, which is subsidized by the government, and the fee is $8.50 a day. And one of the things that we know is happening is that the parents of children or the caregivers of children who are in the private for-profit sector are moving in as fast as they can wherever there's a vacancy in the publicly provided, publicly funded part of the Quebec system. They're moving in as fast as they can. So there continue to be waiting lists for those spaces. And that's the difference. And in provinces where we saw during COVID, where the government did intervene and provided direct funding at rates much higher than normal, like in Atlantic Canada, for example, the sector survived much better, the COVID. So again, an example, we know what the solution is. It's public intervention, it's public funding, it's strong support, it's a public system.
You mentioned
The other difference was not only how governments responded to childcare, but how governments responded to the pandemic. Not every jurisdiction has experienced the pandemic in the same way. I mean, I was having conversations with my colleagues in PEI who were out to lunch while I was still having my groceries delivered in Toronto. And so we've seen, these different experiences depending on government leadership. So it makes a difference across the board.
Mm-hmm. In the very early days of the pandemic, the role of cities became really apparent. Like Toronto, which has a network of municipal childcare centers, could redeploy them quite quickly and start using their publicly owned and operated centers to provide essential childcare to the children of essential workers. Cities like mine, I live in Winnipeg, we didn't have that. There was no capacity to do that kind of system-wide planning quickly. And I don't think it's surprising that in Alberta, we see the new mayor of Calgary talking about the importance maybe of the cities stepping up, because when provinces don't do it, municipal leaders can see what it means at the local level. So the political priority of childcare, I now think, is pretty fixed on the Canadian scene.
You mentioned Atlantic Canada, Quebec, cities like Toronto, places with resources that fared better than other places. Where was the need the most pronounced, from your research and watching the landscape, over 20 months?
Well, I guess the short
those
answer,
patterns
everywhere there were children and families. When schools closed, every place there was a child or a school or a childcare center that closed. I mean, this was felt from coast to coast to coast. The way we get out of it, I think, varies.
And there are childcare deserts where there was less capacity to start with, so of course they were. But, in Toronto, where, the municipally operated centers could continue on and pivot quickly and did a fabulous job, but there are not that many of them, and there certainly are. And the neighborhoods that suffered the most were, no surprise, low-income, racialized neighborhoods where the needs and the anguish was that much greater. So, you can highlight, and we probably should, and doing as we write all of this up in our various ways, highlight what were the elements where early learning and childcare could step up and function and so forth. And I think my colleagues have covered that terrain that one would find. And really, it's no different than before the pandemic. It's just got a bigger magnifying glass on it. It's the same elements.
The other review of Toronto, Jane, that we were involved with, absolutely found that that public childcare was able to respond in an immediate way to meet the needs, not only providing free childcare, but providing 7-day-a-week, 24-hour childcare, which was like unheard of. Where in other jurisdictions, governments had approached their childcare sector to provide that emergency care, but they didn't have the capacity. So in some cases, they had to turn to their schools or to other mechanisms in order to get it started. But again, keeping in mind the kids, right, is that in Toronto, one of the things that they found was that fewer than 50% of the children that were receiving a subsidy in February 2020 are back in childcare. And that has to do, because they're lower income families, that has to do with the nature of the labor force. And parents are caught in this, I don't know if any of you have seen The Maid, but there's this wonderful line, which I won't repeat because it has a swear in it, but it's just this wonderful line about where she's told, well, if you had a job, you could have childcare. And she's going, well, I can't get a job because I don't have childcare, right? And it's this cycle of stupidity that we put families in, as they try to do the best for their kids.
And I wanted to make a point about the kids. My background is early childhood education and working with young kids and families. I did it for quite a while when I was younger. And I think we sometimes underestimate how important these places and spaces are for young kids. This is where play and friendships flourish, and they care a lot about it. They actually usually care a lot more about their friends than they do about the educators who are making it all possible. They value their friends. If you ask them when they're 3 and 4 and 5 years old, what do you really like about being here? It's always about the friends and the play. And this gets, Carrie mentioned about we don't take kids, if mother loses her job and the child's in grade 1, we don't take grade 1 away, but that's what happens in early learning and childcare. And that's what happened in the pandemic. All of a sudden, children no longer had access to these social spaces, and younger kids haven't had access to them, and they've been, sheltered in their homes. And I think we often underestimate that critical cost to the well-being and the happiness of our youngest children.
We've got an audience question from Anna Andreaza. Are there any studies looking at the impact of the pandemic on the mental health of childcare workers? We touched on childcare workers a little bit earlier about how they were undervalued. Are you aware of research looking at mental health impact for this particular cohort?
Underway, but nothing proposed and underway, seeking funding, but I don't. Others, Susan, you may know of something
Not
more
specifically,
definitive.
but one of the things we do know about the labor force, the folks whose paid job it is to provide childcare, somewhere between 96 and 98% of them are women, and many of them are younger women. So many of them themselves will be mothers. So it's one of the most feminized labor forces in Canada. And we also know that a surprisingly high share need to have a second job because their own wages are so low that they can't afford to work in childcare, which is it's intrinsically rewarding work, but we have a long legacy of thinking of it as unskilled labor that doesn't have to be adequately remunerated. An idea we had about teaching over 100 years ago and have moved far past. So it's definitely a labor force under strain, even pre-pandemic. So I'll look forward to the studies that are no doubt underway.
We do
Absolutely.
know that there are a lot of qualified early childhood educators who have left the field, who even before the pandemic, chose to leave the field, particularly after a few years, and directly related to, again, the fact that a market system just cannot provide the adequate compensation, the adequate recognition, the adequate systems of respect, the systems of professional development, and so forth. Right. So, but particularly the wages are so poor. And just around mental health, I don't know of any study, but I don't know of any childcare center that has the resources, the programs, because, you know, they have so little money to do anything that would be able to actually provide the support to those that are suffering duress, mental duress and other. And there is no question that, you know, in any of those fields, and, you know, where one had to go to work under constant fear of being sick, not even being able to get the protective equipment that was necessary to keep safe. You know, I can imagine the mental anguish was huge.
And I think what you're saying again was repeated among nurses and the exodus of nurses, another predominantly female field. You know, I wanted to zoom out and ask, we can start with you, Morna, about sort of, you know, the pandemic exposed the absence of this sector, and now the lens is on this sector. You've all been working in this field for some time and know that the problems go back well further than 20 months ago. What are the critical large-scale shifts that we need to ensure this country develops high-quality, affordable childcare so that, you know, working mothers are never put in this bind again through another crisis?
Well, the big shift that has to come, and we've talked about this, is that we actually have to build a system of early childhood education and care. And we know what is required to do that. You have to take childcare off the market. You have to make sure that it is publicly managed and publicly funded sufficiently to be able to ensure that the programs are high quality. By public management, you also need government to intervene to make sure that high quality programs are not just affordable, but they are available where they are needed, when they are needed. So that means, again, not relying on the market for different operators to step up, whether they're, you know, private individuals, really good meaning individuals who are doing it for a profit or for not for profit. You cannot set up a system relying on that kind of approach. You actually have to have government to decide how many spaces we need. This is where we need them. The planning for expansion has to go hand in hand with all kinds of other planning tools that municipalities and others are engaged in. It has to be part. I mean, we often say, you know, the government would never allow a new housing development to be set up without giving some thought to sewage, without giving thought to public transportation or roads getting in and out of the housing development. But it seems to be nobody's responsibility to make sure that essential infrastructure like early childhood education and care is part of that. That needs to change. So this means a big investment, and we're seeing that in the part of the federal government. It means a long-term, ongoing, large investment. I would like to see over years an even greater investment on the part or spending on the part of the federal government. And it's because the provision of early learning and childcare falls under provincial jurisdiction, but because no province has the full fiscal capacity to be able to fully publicly fund the system, it means really close cooperation between different levels of government. And I would suggest also municipal and local levels of government, including the school system, to be able to make it work.
Carrie, you had also mentioned this provincial federal tango as far as childcare goes, and large scale shifts. What can you tell us about that dance that goes on between the tiers of government here?
Well, you know, when we look at the deals, there's two sort of benchmarks that provinces and territories have signed agreements must meet. One is that you'll get fees down to an average of around $10 a day. The other is that you'll increase capacity so that you're covering at least 59% of your 0 to 5 age group. And then beyond that, they're not very specific. You know, you should do something about your workforce, et cetera. But going back to Morna's point, the government has put out a lot of money, and they're asking the nonprofit and public sector to pick it up. But we've just been talking about the weakness of that sector. it doesn't have the capacity to absorb that amount of money and make it work. You absolutely need a strong, and there's nothing in the deals that direct the provinces to do this. There's nothing in the agreements which say to the provinces, it is your responsibility for ensuring that this money is well planned, that it's equitably used in order so that every child has an equal chance of participating, that it has to be good, to ensure that kids don't, benefit from participating in it. And I mean, this is what it means to build a system. You don't build a system by putting money out and expecting overtaxed voluntary sector to take on, construction and planning and hiring new staff when there aren't staff to hire. So it's ridiculous, actually, that there isn't more direction from the federal government about the execution of these deals.
Well, I think,
just briefly,
Carrie, I would just want to respond quickly. One thing, you can't do it without money. And we all know in a federal provincial system of Canada, one of the ways you get goodwill and you start building systems is you actually put money on the table and you negotiate. Nobody can underestimate how big a task it is. And I do not believe that governments alone can or should do this. It should be regarded as a major democratic citizenship project to build a system, just as the public education system was, and still is, and just like healthcare. It's going to need strong voices of advocates, of parents, voices from every sector. That's how we're going to get it right. And I disagree that we can just, the federal government can issue a prescription. It is going to have to be something that is worked out, but critical to that has been the funding that has been put on the table. And I would suggest that it has not been unconditional. There are some very, very implied and explicit requirements of how that money is to be used. And a lot of them are key elements, are going to address key elements to system building. For example, addressing the very low compensation and addressing problems related to the recruitment and retention of the workforce, ensuring that there is expansion and that it is planned and that they're put in place expansion plans. And the other is that the fees have to go down, and that requires direct funding of services. So I think we have elements. I don't disagree, Carrie, it's not enough. Money is never just enough. But I would hate for people to think that that's, the wrong way to go. I think it is a very good start. We have a lot of work to do. And I hope everybody who's listening continues to be engaged, because it's going to need everybody's help and support to make it a good system, especially in the long term.
Yeah, I agree. Money is critical, but how the money is spent is also very very important. And in the same way as going back to your example, as you develop a new housing development, who decides whether or not childcare needs to go there? That is the job of governments. And to expect that a voluntary sector,
with full consultation with people in communities, not alone. Yeah,
this is a culture
absolutely
shift.
Well, schools aren't built without consultation.
Exactly.
Hospitals to take it. It's not saying that these are
exactly
are edicts, but not every agreement. Every agreement talks about professional development for the childcare workforce, but every agreement doesn't talk about compensation or working conditions for the childcare workforce. And if we want to maintain if we want a workforce that is going to stay in the licensed childcare sector, those things have to be addressed. Because if you have an ECE qualification, there are now lots of places that you can go and have your needs addressed. Schools are crying for early childhood educators, but they also don't have any trouble recruiting them. The health system uses early childhood education. Settlement services use them. There are a lot of places where educators can use their credentials and not have to deal with the with the inconsistencies that exist in licensed childcare. And the difference between that is one is a public system, and as we've said, the other is a market system. And it's going to take more than just nudging the market system over. It's going to take governments really rolling up their sleeves the way they did in World War II to make it happen.
Well, World War II.
I wanted to ask you, Susan, about World War II. We wanted to look forward, but also back.
Right.
You study childcare through a historical lens during other crises, including World War II. Can you remind our viewers what was done well for working mothers then?
The Dominion Provincial Day Nurseries Act of 1942 was one of the only times that the federal government has ever really stepped up and said, at that point, they called it a manpower shortage during the war. And the Dominion government of the day made under 50-50 cost sharing with provinces that were willing to start up childcare programs. Only a couple of provinces did. And in Toronto, it's the legacy of the municipal programs today. But it takes a big shock to make political culture change. And, we saw it during World War II, and it got eroded because although many other countries built family policy into their post-war welfare states, Canada was kind of aberrant, along with a couple of others like the United States. And so we have a political culture which kind of forgot that during a war, childcare was a part of how the war was won, because Rosie the Riveter couldn't go to work without childcare. And I think it's slept as an issue for a long time, despite the best efforts of feminists and others to put childcare on the political agenda. But it's an interesting culture challenge, right? How do you take something that's been seen as a private family matter, or maybe just something that the market can privately, leave to do? And how do you create that as an entitlement? I mean, it wasn't very many weeks ago that Quebec made quite a transformative declaration that all children would have the right to early childhood education as a child's right, not only because her mother worked or her father worked. So we have to figure out how to build childcare that simultaneously responds to children's needs, something that the Convention on the Rights of the Child tells us, and yet also works well with their parents and their work schedules, and doesn't relegate women to a second-class status in the labor market. I mean, one of the reasons we have such high female poverty rates is because of care responsibilities. So I think the legacy of this pandemic will be culture transformation, but it is hard to live through, and it is hard to institutionalize because there are lots of forces asking us to not make transformative changes.
And I think one of the ways we'll make transformative changes is being able to look across our provincial and territorial boundaries and be forced to learn from each other because it's in front of us. And yes, we all have a role in that, at doing connecting and convening so that we can learn from each other. That's what happened with public health care. It looked very, very different in different jurisdictions, but there was a lot of looking across the borders, and it's not perfect. I'm not saying it is, but it is much more universal and more consistent across the country than it was when it first came in 1962-3. So I think we have to think about how we can all be part of that and how we can encourage governments to step up the game and provide that publicly managed system that we want to see in place, to move it into a right for all child, to something that children are entitled to. And there are variations in the plans that are emerging. I would argue, I'm not going to name names, but there are some right now that are stronger on some aspects than others. So we need to think about how we can move things across borders and keep that up so that we do have something that is consistent, that is high quality, that isn't market driven, that is publicly managed or publicly delivered. And yes, we all have a role in it. It's part of democratic society, civic society, but it's not just the nonprofit sector or just parent groups or neighborhood groups. It's got to have that solid platform to work from in order for it to be effective. So otherwise, it won't be. Those that
In terms of
organize
looking across borders, just a few hours before we got on this call, Alberta announced a deal with the federal government. Just briefly, what stood out to you? Was it consistent with the other provinces? And do you see sort of glaring gaps with that province's deal as inked today?
Well, I think what we haven't seen yet from Alberta, and we are actually still waiting from some other jurisdictions, is a specific action plan that will be agreed to that would implement and move forward what was agreed to. So we did see an agreement announced today, which will create 42,500 new spaces for children under the age of 6. They'll be in the regulated sector. They will be in the not-for-profit, public, family childcare sectors. What we don't know is how those get rolled out. How do you put into place over 5 years? This would more than double. Would be a 150% increase in the number of not-for-profit spaces that exist now in Alberta. So it's a massive expansion in a very short period of time. As has been pointed out, we have a problem of recruitment. We have a labor shortage in the sector. So it's what we saw today was a framework. We know we have to, they agreed to more spaces. They agreed to bring down the fees. They agreed to address wages and put in place a provincial wage grid. These are all good steps forward. There's going to be an implementation committee in place, which will involve the federal government, the provincial government, and key stakeholders, which will discuss how this actually gets built. But transformation is going to be complicated. And particularly in a province like Alberta, where we saw when the agreement was announced, the Alberta government kept stressing their mixed economy and the fact that the childcare sector provides a lot of employment for women entrepreneurs. So we have a lot of room we have a lot of ground to still make up, because what we're saying is, when we say it can't be a market system, childcare should not be regarded as an entrepreneur's opportunity or an entrepreneurial opportunity. It has to be regarded as an essential public service and treated as such. So yes, government is key. And I just want to say, with respect to Quebec, because we've seen a lot of agreements being announced and movements, really exciting movements, is the Quebec government, as Susan said, introduced legislation which in law would make it a right, puts in law, recognizes the right of children to early childhood education. But what was really important is the government also said it would take responsibility to make sure that that right is realized. So where there is no community-based childcare center or provider, the government will intervene and do it itself. That is a hugely important move because it's all very well to say you have rights, but for governments to say you have rights, but governments actually have to help realize those rights. That shouldn't be left up to individuals. That is a government responsibility to ensure that people's rights are respected.
Vis-a-vis Quebec and the rights of children.
Project. In Alberta, it's a work in project. Everywhere, it's a work in project. I tell you, we've only just begun.
Short on specifics, yes.
Anybody who thinks that we've got a Canada-wide childcare system because agreements are signed, I don't know that anybody really believes that. But at least we have some money to work with. We have a framework. We have governments at the table, and there is a commitment to move forward, and there will be accountability. Again, we're going to have to watch really carefully to make sure those accountability measures are followed. So a lot of work to be done.
In other words, the specifics. We talked about the rights of the child in Quebec, and Carrie, you had mentioned something really interesting about this being one of the only care realms that it's unclear who the client may be. For some, it may be the child. For some, it may be the parent. How did this? What were the ramifications of this question throughout the pandemic? Is this a realm that serves children or parents?
Well, childcare has been developed as a labor market support for parents. If you look at the legislation around regulated childcare, it's It is all geared, towards your eligibility, whether you get a fee subsidy, et cetera, has to do with whether or not you're in the paid labor force and you don't earn enough money. On many levels, it was a welfare service. For a long time, only mothers on social assistance were eligible for a childcare subsidy. So it's very much developed as a labor market support. Over the years, because of advocacy, we're seeing more and more attention being paid to the, to supporting the workforce to deliver a program which is more child-centered. But nevertheless, you're in or out depending on whether or not your parents work, either because they can afford to pay for your care or because you'll get a subsidy for it. But we need to recognize that the early learning childcare sector goes beyond licensed childcare. In Ontario, for example, 250,000 children get their early education in full-day kindergarten. And that has an impact on mothers because we see that when children go to school full-time, that mothers' labor force participation increases, or they're able to expand the number of hours of work that they have. And again, from a child's perspective, as we pointed out, you still get to go to kindergarten, whether or not mom is working or not. So we have to admit that in the main, even with these new deals, which are focused on bringing the cost of childcare down for parents, the client is still the parent and not the child.
Sorry, go ahead, Susan.
I'm just going to say this is a North American point of view, but it's not true everywhere. When we look around the world, we see different places. I mean, I've spent time in sabbatical in France, for example, and by the time you're 2 or 3 years old in France, everybody knows children will flourish in école maternelle, and children get to go to without fees to childcare centers and to early education settings in schools. And if you're in Sweden, I got to spend some time in Sweden, after your child is about 3 months old, you're allowed to walk down to City Hall and your child is entitled to go because it's good for children. So the political culture has a lot to do with who we think childcare is for and when we think school starts, and where responsibility begins. And what we're seeing is the creaking dinosaur of North American assumptions shifting to recognize that childcare is both good for children, it's early childhood care and education, and it is good for their parents, and it serves the economy. I mean, we now have this whole new appreciation in Canada. The care economy provides about 1 in every 5 jobs in Canada and is worth around 13% of Canada's GDP. So we have to design good programs that work for all of these people. And it's culture shift and it's a political shift and it is creakingly slow, but it is underway.
My final question, we've got 2 minutes left. My final question was about the economics, and you've touched on that. Beyond the creation of these care jobs, Jane, you talked about the good this does for children, early childhood education, in terms of their economic prospects, that
Sure.
Economically this widens well past the actual jobs this sector creates.
Yeah, there's also economic benefits by children participating in high quality ECE settings. And those include a reduction in special education needs when they go into grades 1, 2, and 3. It's actually quite substantial. There are a number of studies that show increased academic performance, increased graduation from high school, increased participation in post-secondary, and higher wages, productivity in the workforce. It goes all the way down the line if it's high quality and a good, and long enough duration. Those are strong economic benefits now and in the future, well documented from numerous sources in Europe, in the States, and in Canada, some of them just recently. And I think we should pay attention to that. It's very important. But I'm going to go back to the point I made earlier. The priceless benefit of ECE for all kids is that it is a space and place dedicated for them to be with their friends and to play and to flourish and to have healthier, happier childhoods, regardless of what their parents are doing. And we can't there is no economic study we can do that really can quantify that, but we should keep that in mind when we think of the longer term economic benefits.
Carrie, last word to you. I interrupted you.
We have a lot of Made in Canada studies that look at the cost benefits of public spending on childcare in terms of it being a job creator in its own right, local economic development, as Jane said, in terms of equipping the future workforce. And that is no small thing, because we have an aging population. Fewer children are being born. The need for everybody to be at their best is going to be quite paramount in the not too distant future, not to mention the huge challenges we're placing on the coming generations to solve, climate change, the mass movements of people, some of the horror shows that this planet is experiencing, that we are going to land the next generation with. So it's not a small thing to say that everybody has to be at their best. Quite frankly, if humanity is going to survive.
Well, on that note, I so thank you all for your deep knowledge and expertise. We'll be watching provincially what the specifics are and doing our job as journalists to hold them to account as these programs roll out. So I thank you. I thank you for your time today, scanning this landscape, 20 months out.
Thank
Thank you, Sosha.